New tonight at 11, it's the latest trend in plastic surgery inspired by Latin pop superstar Jennifer Lopez for some.
We're talking about gluteal augmentation, otherwise known as butt implants. How do you like that? Action News anchor Linda Hurtado joins us now with more on this cosmetic surgery. Very delicate name for this surgery.
Yes, it is, Marty. Say goodbye to the waif look. Big booties. Did I just say that? They are in, and we went to Miami Beach to show you the latest procedure, surgically inserted padding for your posterior.
Miami, South Beach, bringing the heat.
Want a beautiful body on the beach? Who doesn't? It's the definition of beauty that's changing.
I like big butts and I cannot lie. You other brothers can't deny.
Thin may have been in, but now women and men are in search of a sizable seat. What's behind this fanny fad?
More people are hearing that buttock implants are done, but in particularly Jennifer Lopez. I've been doing considerably more over the past 4 or 5 years, almost in relation to J-Lo's increase in reputation.
Dr. Howard Tiller transforms 2 tushes a week. Who is your typical client?
The young woman in good shape who you would think to look at them needs nothing done, but desires a more shapely, contoured buttock. The man is a person who has gone to the gym, looks good, but also likes to have bigger, more muscular-shaped buttock.
His youngest client, 21. The oldest, a 58-year-old woman. What about famous clients?
Yes.
Mm-hmm. Yeah, that's it. 30-year-old Madeline Hall wanted the right rump for modeling assignments.
Madeline had a very full chest before the surgery, and what it did was balance her figure and made her look perfect, really. She's now at 11 on a scale from 1 to 10.
So, what does it cost to get great glutes? Well, Dr. Tiller charges about $8,000. But some people will tell you the confidence gained by improving your assets is priceless.
Little incision here. And it goes
Dr. Tiller says he's been reworking rear ends for 12 years. First, transferring fat. Now, putting silicone implants like these into a 2 to 3 inch opening made at the tailbone. The incision is hidden. But what does it feel like?
You look like you're sitting comfortably.
The first few days feels like you're sitting on top of something that, you know, it's not right, and so you want to sit different. But after 3 or 4 days, you can sit on it and feel comfortable.
You can do it, put your back into it.
A lot of people may ask, is the procedure safe? Some people hear about breast implants that rupture.
I think the implants are very safe, long-term use. It's not to say that the surgery itself is risk-free, such as infections or dissatisfaction with the result, but the implants themselves, the material, have a long track record.
Tiller warns that consumers looking for a less expensive lift may opt for an injection alternative that leaves silicone scars.
Never did I wanna be here again.
People have it done by goodness knows who in their kitchens and, you know, back rooms of hair salons. People have died from that type of thing.
These are pictures of patients Dr. Tiller has had to patch up. He says cheap isn't the best bet for a better butt.
Homeboys tried to warn me, but that butt you got makes me so horny.
All right, a less drastic surgical alternative is liposuction or liposculpture. By removing fat from the waist and below the buttocks, you can sometimes create the illusion of a more curvaceous buttock. That surgery is less invasive, and the recovery time may be easier.
And the scar is in the crevice, shall we say.
That's
it's
right.
not
So
visible.
You could wear a T-back and no one would ever know.
Well, that's a relief to know. Plus, you're a couple inches taller, I guess, when you're sitting down.
I guess so.
Depending on how big the implant is, I guess they use different sizes,
They
right?
can, actually, that's a good point, Marty. You can request a different size. He will actually show you the